Now, you know, the people who make these decisions don't have to live with the decisions that they make. But the people who are affected by those decisions have to live with those decisions. And a lot of times the power structure never really thinks about that.
We service 27,000 cases on the public assistance side, and several thousand is difficult to quantify in the rehab services side, which works with disabled individuals. There are almost 70 employees who are members of this local working in that building. We see about 250 customers a day. And we found out recently that, in fact, a year ago, without telling anybody, the state made plans to save a little money by closing out that building and moving us all to a building which is not in good shape up the street here in the Humboldt Park community. So we think that this is a bad move. It's being done for the wrong reasons. The building, as I say, that they want to move us and our customers into is actually quite derelict. It's been in housing court for 2.5 years, we found out in the course of this investigation, and we oppose it, and I hope that the speakers to follow will be able to flesh out these points.
You know, as Steve has said, this is obviously an attack on the social safety nets in this state, and any attack against the social safety nets are attack against the poor. Any attack against the poor is attack against the workers who support those individuals. And what we want to hear from now is the people who are being affected by this issue.
The population that I work with are blind or visually impaired. And if you think about that, for that connection to happen, it's a little more challenging, you know, because if you all were to have to go home tonight with a blindfold on, you know, you would realize that it's a little difficult getting used to that, for one thing. And then, so the one thing that has to happen for these individuals is that they need an accessible office to go to, and they need an ability to get to it easily, possibly at a time when the vision loss is new. So accessibility becomes a key issue when you're dealing with the blind and visually impaired, especially the newly blind and visually impaired population, for their rehab needs. And that's why it's so critical that we're in a place that they can get to us, and we can meet them, you know, in an area that's confidential, where that's not compromised, that they're not put in any kind of extra physical restraint if they may have diabetes and other problems. I also serve a senior population. We have a special grant from the federal government where I serve seniors. So, you know, if we're connecting, it can be especially difficult if I have somebody that can only walk a block and things like that. So that's our main concern.
Now we're going to hear from our brother, Larry Biondi, who is the Advocacy Director for Progress Center for Independent Living. Larry.
Good evening. My name is Larry Biondi. I'm the Advocacy Coordinator at Progress Center for Independent Living in Forest Park. Progress Center is one of 23 centers. We service 133 municipalities in suburban Cook County. We provide 4 core services: advocacy, information and referral, independent skills, training, and peer mentoring. This will be my 19th year working at Progress Center. I started as a Deep Guard 110 intern under the Department of Rehabilitation Services. 6 months later, I was employed full-time at Progress Center. So without the successful place meant by Deep Guard, I wouldn't have a job. So this public hearing is very meaningful to me. As a consumer and as the Advocacy Coordinator at Progress Center, I've been working with other groups, such as ADAPT, that. I'm also a proud member of. To fight back against Governor Quinn's proposed cuts that would endanger the lives of people with disabilities. This is no exception. The closing of the Milwaukee office would also hurt persons with disabilities. I've got problems with the closing or consolidation of the Milwaukee office. As with any bureaucratic agency in state government, this would mean more case loads with less staff. The guard as consumers would be affected. As a result, the services for consumers would be compromised. They would be inadequately assisted because of more loads with less staff. It's a shame that consumers must always suffer when we hear state budget cuts, isn't it? By closing the Milwaukee office, consumers of this office would have to go to the Humboldt Par the Guard S office. The Humboldt Par office isn't DBA compliant. There is a small elevator at this office, making it inaccessible to consumers in wheelchairs. How does this office expect to accommodate its new consumers when it's not DBA compliant to its own customers? I don't understand. In closing, it's a bad idea to close the Milwaukee office and consolidate it with the Humboldt Par office. But it only hurts clients. And we can't have that.
Thank you very much.
With people like me and people like him and others, just people who don't have disability, going to our social worker, asking them for help. I mean, we got some good ones. I have some good ones, okay, that actually really helped me to get the P3 check, which is a personal check that gives you to go along with your food stamp. You know, without the Department of Human Services, where are we going? I mean, I could still go to Stokey, but my other brothers and sisters who live in Humboldt Park, Wicker Park, or the South Side, Bellwood, where are they going? People like us need to tell our governor, he a bastard, okay? We need to tell him, we don't need no cuts. We need to keep those centers open.
Yes, brother.
Hi, my name is Dick David. I'm a pediatrician at Stroger Hospital. We have to fight every one of these fights. It might just be trying to keep this office open, trying to keep this patient from being taken out of health facilities, whatever. We have to fight each one of these fights. But we have to also think about these big questions. The fight against racism, the fight for the 99%, as the occupiers call it. This is what is being opened up now. I think, you know, we already tried getting the Democrats instead of the Republicans. That hadn't gotten us very far. We already tried getting an African-American president. No offense, but it hasn't gotten us very far either. We're going to have to get something like what I see in this room, a nice multiracial mix of people from the community, working people who know that we got to fight for what's right. And we're going to have to turn this thing around. Thank you.